So I play bassoon, which is a wind instrument, and I was just like getting extreme pain in my forearm and wrist. I had rhomboid area pain, and I've been to a bunch of doctors for it over the past like year and a half. An orthopedist, several orthopedists, spine doctors, shoulder doctors, extremity doctors, physical therapists, and just nothing worked and nothing helped. And like with all the physical therapy too, it just wasn't getting better. So I was just looking for something that would get better, would help it get better, and Barefoot Rehab looked like the thing that would help it get better.
Maggie's problem is that she's got these really heavy black lines on her forearm because she's always writing notes to herself and always making fun of her. Just kidding, that's not our problem. Love you, Maggie. She came in with upper back pain. She's been having this since 2016, 2020 got worse. This upper back pain and also wrist pain prevents her from playing the bassoon. She needs to play her instrument in order to get her degree from college, and she's really scared that it's was gonna prevent her from being able to play her instrument.
I think it was just overuse. It first started when I was playing in a all-day rehearsal for an ensemble I was in, and my wrist just started hurting, and after that, like, it went away because I wasn't playing as much. But going back to school in the spring semester and having to play a lot more than I had since COVID shut all the ensembles down, I wasn't playing at all. So hopping back into that and having to play in like 2 different ensembles was a lot, and it started hurting like every day when I would play.
So she came in here, and initially we started just working on her entire forearm and her hand, and we were getting progress. She was able to play longer. Then eventually we said, okay, you have to see handsome Dr. Joe for your upper back pain. Her rhomboid area pain was coming from a disc problem here. So after working with Dr. Joe to clean out the top of her neck, her suboccipitals, all of the muscles working down, the rotational muscles, the upper rhomboid pain has gotten better.
Just being able to practice and play my instrument to the ability that I want to. Like, I'm a music education student, so being able to play my instrument is my life and my degree. So not being able to do that is super frustrating, and my school's wind ensemble is going to Prague next summer, and I really want to go to Prague, and it's just the stress of not being able to practice to my full extent because of my like physical limitations was just super frustrating. I had just tried so many things before, and I was just really willing to try anything because, like I said, it's my whole degree and like my life that is being put on hold because of my body, and the hope that it would work was enough for me to be like, yes, let's do it.
So it's been a process of continuing to get rid of all the adhesion in her hand and her forearm, and then also in her neck and upper back. In the meantime, we've given her strengthening exercises just to stay strong.
Dr. Chris is great, and he's always like making conversation during the appointments and like trying to take the focus away from what he's doing with like the adhesion and just like making sure you feel relaxed and comfortable, which is really nice. So for me, I have a lot of adhesion, so it just feels very crunchy, and then sometimes he'll end up like hitting a spot that hurts, but he's always very like calming and being like, okay, like 5 more seconds, you're almost done.
And she also has POTS. So this is an autonomic nervous system condition when the body is stuck in fight or flight, sometimes from emotional wounds trauma, sometimes from different viruses. You can also have susceptibility to Ehlers-Danlos syndrome, where the connective tissue is just very loose and weak. And so we've explained to Maggie that this is a big deal, paying a lot of attention to her diet, de-inflaming herself, taking care of her stress levels is also a big piece of it. So once again, this whole comprehensive diagnosis is important.
Oh, I feel so much better. Like, I feel so much less stress about like going back in the fall and having to play in ensembles and like with auditions. Like, I used to not be able to play like more than 20 minutes, and now I can play like an hour, like upwards of an hour, and it's really great.
She's about 50% better in her symptoms. She can play the bassoon about She had to stop playing her bassoon after 20 minutes. Now she can play well after an hour with less pain, less symptoms. So that's awesome. She's really happy. And she has a little bit more adhesion, but unfortunately she's going back to school. So now she's going to be on her own to take care of herself.
Anyone that has been to like several doctors and all the doctors are like, you should go to this doctor, he can help you. And then that doctor says, you should go to her, like she'll help you instead. And then that doctor's like, go to physical therapy. And like, I don't really see anything wrong with you, but go to physical therapy. And the string of doctors that's never ending, like I think Barefoot could really help because that's what I went through. It's very welcoming, I really like it. Everyone's always so happy and cheerful and like asks if you need anything, how is your day going, and just like even the office is very calming and there's a lot of things to look at, like motivational posters and just like cool little things, and I feel comfortable in the office.